Nerve supply of various arches. First arch is supplied by mandibular nerve. First arch has contributions from facial nerve. Also, facial nerve gives a chorda tympani nerve. Chorda tympani nerve is a pre-traumatic nerve of first arch. Chorda tympani supplies the taste sensations for anterior two-thirds of tongue. Second arch is supplied by facial nerve. Second arch receives contributions from glossopharyngeal nerve also. Cranial nerve 9 gives a branch to second arch which crosses cleft. It is called tympanic branch of glossopharyngeal nerve. Tympanic branch of glossopharyngeal nerve is the pre-traumatic nerve of second arch. Third arch is supplied by glossopharyngeal nerve. Vagus nerve gives two branches. Superior laryngeal nerve from fourth pharyngeal arch, recurrent laryngeal nerve from sixth pharyngeal arch. Arches and corresponding nerves. First arch, second arch, third arch. First arch, mandibular nerve, pre-traumatic nerve of first arch. Chorda tympani nerve, pre-traumatic nerve of first arch. Second arch, facial nerve. Third arch, tympanic branch of glossopharyngeal nerve, pre-traumatic branch of second arch. Development of tongue. Floor of pharyngeal arches. Second pharyngeal arch does not contribute to form the tongue. First pharyngeal arch forms anterior two-thirds of the tongue. Third pharyngeal arch forms terminal sulcus, foramen cecum, posterior one-third of tongue, palatine tonsils. Fourth pharyngeal arch forms posterior most part of the tongue, epiglottis. Now supply of various parts of tongue. Anterior two-thirds of tongue, mandibular nerve for general sensations. Chorda tympani, branch of cranial nerve 7 for taste sensations. Posterior one-third of tongue, glossopharyngeal nerve, cranial nerve 9. Posterior most tongue and epiglottis. Superior laryngeal nerve, branch of cranial nerve 10. Development of tongue. Anterior two-thirds of the tongue develops from two lateral lingual swellings, one tuberculum impar in the first pharyngeal arch. Third and fourth pharyngeal arch contribute to form copula. Copula is a midline component. Circumvallate papillae migrate anterior to sulcus terminalis. As they migrate anteriorly, they carry branches of glossopharyngeal nerve also. Posterior most tongue and epiglottis is supplied by internal laryngeal nerve, branch of superior laryngeal nerve. Tongue muscles. All tongue muscles except palatoglossus. They are derived from occipital somite. They are supplied by hypoglossal nerve, cranial nerve 12. Palatoglossus muscle. It arises from fourth pharyngeal arch. It is supplied by vagal branches. All skeletal muscles are derived from paraxial mesoderm forming the somite. In the head and neck region, we have somatomere, two types of myotomes, pre-otic myotomes, from skeletal muscles of eyeball, which are supplied by cranial nerve 3, 4, 6, post-iotic myotomes, occipital myotomes, form tongue muscles, which are supplied by cranial nerve 12. Cranial nerve 3, 4, 6, 12 belongs to GSE, general somatic efferent. Cranial nerve 5, 7, 9, 10, 11, 12 belongs to SVE, special visceral efferent, as they are derived from pharyngeal arches. This is important information. Again I am repeating. Cranial nerve 5, 7, 9, 10, 12 belongs to special visceral efferent, as they are derived from pharyngeal arches. Pharyngeal pouches and clefts, coronal section of pharynx. Pharyngeal arches are seen in lateral wall of pharynx. Pharyngeal gut or tube is lined by endoderm. Endoderm also lines the pharyngeal pouches. 4 pharyngeal pouches are seen on each side. Pharyngeal clefts are seen in lateral